Today, I am proud to announce the government is launching the Palliative End-of-Life Care Grant Fund. The new grant program responds to the feedback we received from the folks who care the most about these programs. It builds off the $9 million in funding we have already committed for other initiatives to service providers, associations, and in community groups to advance palliative and end-of-life care. Some examples include more than $1 million to the Alberta Hospice Palliative Care Association to increase awareness of hospice palliative care, develop volunteer training resources, and bereavement supports for Albertans. Another $1 million for the government-sponsored palliative coverage program to cover the costs associated with pre-filling syringes for palliative clients, and $150,000 to Pilgrim's Hospice Society to advance community hospice care. Through the New Grow Grant Program, Alberta Health is seeking project proposals from eligible applicants that support 4 priority areas: earlier access, education and training, community supports and services, and research and innovation.
In September 2020, Minister Chandro asked me to help out by engaging Albertans so that we could better understand the palliative care and end-of-life system in the province. When I started, I had a very limited experience with the subject matter. I was eager to learn directly from those who were most involved in providing that care. We conducted 35 virtual meetings across the province and a number of in-person meetings from Peace River down to Medicine Hat where the situation would allow, and spoke to hundreds upon hundreds of Albertans, many of whom are directly involved either as patients or as family members or as caregivers. And it helped us to identify what is working well in palliative care, in the delivery of the service, but where gaps remain as well, and how we can allocate the funding that the Minister just announced for the remaining $11 million to better serve Albertans.
The need for quality palliative care will continue to grow as Alberta ages. In fact, with our growing seniors population, we're expecting the number of deaths in Alberta over the next 20 years to double. So we need to make sure now, today, that we're prepared individually and collectively to meet that growing demand. Seriously ill Albertans and their families often face many decisions about their care and personal wishes, and they have to deal with this at a time when they're most vulnerable and under great stress. Early palliative care interventions, as contemplated in this report following the diagnosis of life-limiting illness, is enormously beneficial to patients for quality of life and overall life expectancy. Through investments such as these, we are able to assist seriously ill Albertans and their families when they're at their most vulnerable and facing many decisions about their care and personal wishes now and into the future.